Hello doctors, today we are going to understand the types of angina. Many a times patients do come to us and we have already done few investigations from which we are supposed to understand whether this is a chest pain or angina, and we have confirmed that this is angina. Now, we need to understand what are the types of angina that do exist in a patient. So, the types of angina, if at all you talk about, there are two major types of angina. The first one is called as a stable angina, and the second one is called as the unstable angina. So, two parts, one is stable, second is unstable. Now, how to understand whether this patient is in stable angina or unstable angina? What are the differences in between these two types of angina? The first difference, the most important difference that we have to understand is about the emergency part of it. Many a times it is seen that if at all you talk about the emergency part of it, stable angina is not such a big emergency. So, it is not an emergency. So, if at all you talk about emergency, so stable angina is not such a kind of emergency, but unstable angina, it might be an emergency. You need to think about it twice. If at all the patient complains of unstable angina, it might be an emergency. So, the first thing is the emergency part of it. The next part of how to understand whether it's stable or unstable angina is what is the predisposing factor. That means what aggravates this whole disease. What aggravates is stress or any kind of exercise or exertion. So, a stable angina predisposing factor could be stress, exercise or exertion, while in case of unstable angina there could be pain at rest also. So, this unstable angina can be seen in a patient even while resting position, even in sleeping time. Any time the patient might present up with chest pain which is intense and which has a clear ECG indication of it being an angina. So, this is nothing else but unstable angina, while stable angina has an aggravating factors like these. Next most important thing is the predictability. So, if at all we talk about, can we predict this angina? Stable angina? Yes, we can predict the stable part of the angina, because we do know if at all this patient walks for a certain distance or lifts up certain weight or exerts himself to a certain extent, yes, the patient might enter into some kind of chest pain which could be stable angina. But in case of unstable angina, if at all you look out, the predictability of this unstable angina is zero. All of a sudden the patient might present up with some kind of chest pain which could be an angina, which might not be angina, and this chest pain would be aggravating, and on the basis of few investigations we will be able to understand whether this is angina or whether this is not angina, but the predictability of unstable angina is almost nil. So, that is about the predictability. Now, if at all we know what aggravates it, the most important thing is what would lead to this stable angina reduction. So, what reduces this pain or what reduces this stable angina is nothing else but rest. If at all the patient rests for some time, the reduction of stable angina is very well easily observed with good amount of rest. But in case of unstable angina, rest is not the factor which will reduce down the unstable angina. And the last most important thing, if at all we talk about, it's going to be medications. So, usually it is seen that medications normally helps the stable angina to reduce. Stable angina can be immediately controlled with good and specific medications if at all it's used in that moment. But if at all you talk about the unstable angina, effect of any of those medications which are anti-anginals, whether it's allopathic, whether it's Ayurvedic, the anti-anginal medications don't work as what they work in stable angina. Unstable angina, the effect of those medicines is not observed to that level. So, at the end, what we need to understand is two types of angina. One is going to be stable and unstable, and these are the typical differences to identify whether this patient is in stable angina or unstable angina. So, that is how you need to get those differences in between these two anginas. Thank you very much.